Besifloxacin is a fluoroquinolone antibiotic agent used for the treatment of bacterial conjunctivitis. In this video, let's found. What is besifloxacin? What is besifloxacin used for? Contraindication. What are the side effects of taking besifloxacin? How does besifloxacin work? How to use besifloxacin? What is besifloxacin? Besifloxacin is a fluoroquinolone antibiotic. It is sold under the brand name Besivance in Korea, and under various names in India. It is not approved by the FDA for use in the United States. What is besifloxacin used for? Treatment of bacterial conjunctivitis. Bacterial isolates that are susceptible to besifloxacin include CDC coroniform group G, Corynebacterium pseudodiphtheriticum, Corynebacterium striatum, Haemophilus influenza, Moraxella lacunata, Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus hominis, Staphylococcus lugdunensis, Streptococcus mitis group, Streptococcus aurelis, Streptococcus pneumoniae, Streptococcus salivarius. Contraindication. There are no contraindications listed in the manufacturer's labeling. Side effects: red, itchy, or irritated eyes, eye pain, blurred vision, headache. Pharmacodynamic. Besifloxacin TER concentrations were higher than Mic 90, minimum inhibitory concentration, values for common bacterial pathogens, and sustained for 24 hours or longer. Mean residence time in the conjunctiva was 4.7 hours. Mechanism of action. Besifloxacin is a bactericidal fluoroquinolone type antibiotic that inhibits bacterial enzymes, DNA gyrase and topoisomerase 4. By inhibiting DNA gyrase, DNA replication, transcription, and repair is impaired. By inhibiting topoisomerase 4, decatenation during cell division is impaired. Inhibiting these two targets also slows down development of resistance. Half-life. The average elimination half-life of besifloxacin in plasma following multiple dosing was estimated to be 7 hours. Dose. Swallow the tablet with a glass, 8 ounces, of water. Drink plenty of fluids while you are being treated with this medicine. Drinking extra water will help to prevent some unwanted effects of besifloxacin. Besifloxacin should be taken at least 1 hour before or 2 hours after milk or other dairy products. For oral dosage form, tablets. For infections. Adults, 400 mg mg, every 12 hours for 3 to 21 days, depending on the medical problem being treated. Prostatitis is usually treated for 28 days. Gonorrhea is usually treated with a single oral dose of 800 mg. Children, use and dose must be determined by your doctor. Safety advice. This drug should be used during pregnancy only if the benefit outweighs the risk to the fetus. US FDA pregnancy category, not assigned. Risk summary: no data available on use of this drug in pregnant women to inform a drug-related risk, however, systemic exposure from ocular administration is low. That's all the information about besifloxacin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.